In the study called MDS-005, we treated more than 100 patients with lenalidomide. These patients with MDS did not carry the deletion 5q, which is the mutation that renders the patients particularly sensitive to lenalidomide. Nevertheless, a small group, 26%, 27% of these patients would respond. They would become transfusion independent and they will indeed increase their hemoglobin levels. Now, we wanted to understand who were these patients and which were the factors that were predictive of response. And among other factors, we studied the presence of somatic mutation. In this cohort of patients, almost the majority of them, 87%, had mutations. The most frequently found in MDS, actually, the most frequent one being SF3B1. The majority of patients had ring sideroblasts. We unfortunately could not find one specific mutation that would predict for response, but on the contrary, we found that there is one mutation, which is SXL1, that was shown and carried by a substantial number of patients, and this gives, on the contrary, gives less sensitivity to lenalidomide. So patients who have this mutation could be we could avoid treating them with lenalidomide. And we could select the others for a lower serum erythropoietin level, previous treatment with erythropoiesis-stimulating agents, and of course low-risk MDS. We already checked whether there was a gene expression profile that would correlate and predict response, and what we saw was not so strong, and we could not confirm the gene differentiation pattern that was indicated as predictive of response some years ago in a similar trial. So we also evaluated SNPs array. We evaluated the presence of specific difference in whole gene expression. So we are working on it, and we are evaluating several molecular possibly predictive factors. There must be a clue, because some of these patients have responded being transfusion-free after 2 and 3 years from the beginning of the therapy.